The next section we're going to talk about some child abuse issues, and I want us to start with a question. A 10-year-old child is admitted to the hospital with injuries. Which finding most suggests that additional assessment for child abuse is indicated? 1. The child asked to have friends visit. 2. The child asked to have a teacher bring in homework. 3. The child's parents say they need to spend some time with the child's siblings. Or 4. The child's parents will not leave the child at all, alone at all in the hospital. And the correct answer is number 4. This 10-year-old child is theoretically old enough to be able to tell people what happened, although in fact they may not. But the parents are fearful that they may say who beat them up or who injured the child. So that would be a suggestion just to raise the index of suspicion about child abuse. Another question for us. The nurse is assessing a 16-year-old mother for potential child abuse. Which factor is most important when assessing for potential child abuse? 1. Age of the mother. 2. Mother's marital status. 3. Mother's socioeconomic status. Or 4. Abuse of the mother as a child. And the correct answer is number 4. Abuse of the mother as a child. You need to remember that the abused grow up to abuse. So people who were abused as children often tend to repeat the pattern as they become parents. Other things that we need to be concerned about with child abuse. A suspicious history. One of two things can happen. Either the history does not match the injuries. So the parents say the child fell down the stairs and there's cigarette burns on their back or skull burns on their bottom. Those things don't make sense. The other part of a suspicious history is when the story changes every time they tell you what happens. Usually if something catastrophic happens to your child, something bad happens, you remember time freezes and you remember every moment. What song was playing on the radio, exactly what was happening, because time freezes and stops for you. If they tell you the story and every time they were doing something different, the stories between parents don't add up, those kinds of things are suspicious. You wonder what really was going on. As we assess the child, look for skin, look for things that could indicate bruises. Now, some children get bruises when they play outside, but they don't get bruises in the shape of palm prints or the shape of belt buckles. Those would be a suspicious sign of child abuse. When we talk about musculoskeletal injuries, we're particularly concerned about spiral fractures of the humerus in children because that might suggest a twisting. Spiral fractures usually suggest something twisting going on. Internal injuries, for instance, if the child has abdominal injuries that could have been by beating. Sometimes we see shaken baby syndrome when the parents are just shaking the baby and cause cerebral hemorrhages. All of these would be things that would make you suspect child abuse. Rib fractures in infants, they just don't fracture their ribs usually. So those would all make you suspect child abuse. You might want to look at the parent-child interaction and when they're sitting and waiting in the waiting room or the area. If they are, most parents are going to be cuddling and holding their child and comforting their child. An abusive parent might not be doing that, might be more apt to just be sitting somewhere else and leaving the child by themselves. You are required by law to report suspected child abuse. So if there is a possibility that this child might be abused, you are required by law to report it. For answers on the exam, I would choose an answer that said Child Protective Services. Sometimes all the referrals go through one particular nurse and then are referred to the police or Child Protective Services. Now, so you must report suspected child abuse. If the child is born with a problem and there are major difficulties caring for the child, that might increase a risk of child abuse. Make sure they get any referral and supportive services that might make the care of this child easier. Now, I want us also to talk a little bit about SIDS, Sudden Infant Death Syndrome. This is really sad. The child is, they put the child down for a nap, and then the mom or dad says, boy, they've been sleeping a long time, and they go in and the child is dead in the crib. It starts usually in the first 6 months of age. Peak age for this is about 3 months or so. What causes it? We don't exactly know. We do know some things, though. We know that babies that are abdomen sleepers have a higher incidence of SIDS than those that are back sleepers. So we now recommend the babies be back sleepers. We know that the incidence of SIDS is higher when parents smoke in the house. So we recommend strongly that nobody smokes in the house. We know it's higher among premature infants. So what we're looking at here is probably, may not be just one disease. It may be that they have immature respiratory systems. It may be that they smother as they're laying on their abdomens. Whatever the cause, it's a very tragic kind of thing when it happens. There are a couple things that they might ask you about on the exam. One is to make sure that the parents have a chance to see their child and say goodbye to their child if they wish to do so. Some will want to hold their child and say goodbye because it's very hard. This child was healthy and suddenly they're dead and they're going home from the emergency room with empty arms. So make sure that they have the chance to say goodbye if they choose to do so. Make sure also that they have referrals to SID support groups, that their pastor, that someone, friends, relatives, someone knows, anybody they want to has been notified about that, because their grief is just starting at this point. For goodness sakes, do not tell them, well, you can have another child next year. They need to grieve the loss of this child before they think about having another child. Most will have another child that will grow up perfectly healthy, but this is not the time to tell them that. Now, we also want to take a little look at death and dying. And we know that the child's response to either their own pending death or the death of others depends upon their age. Infants and toddlers do not understand that death is the end of life as we know it. They live in the present. They're concerned more about separation from mommy and daddy, but they don't understand the concept of death. Preschoolers, however, think that death is temporary. Preschoolers have probably had the death of a pet, the death of someone they know, whether it's a grandparent or a relative or a friend, and they understand that a little bit about it. But the preschooler is going to say, when I die, will you come visit me? When I die, will you make cookies for me? Can Johnny play with me after I am dead? Now, the school-age child begins to understand the finality of death. They've seen things die, pets, relatives, etc. And they understand that it's the end of life as we know it. So they are more advanced in their thinking than the preschooler. But the school-ager is afraid it's going to hurt. So remember, they're afraid of body mutilation, so they're scared that this is going to hurt. And the adolescent is just plain angry at the fact that they are going to die. They understand about death, all right, and they're mad about it. And they want the world to know they were here. They want to leave a legacy. Now let's do a question. An 8-year-old is terminally ill with leukemia. Which statement would you most expect the child to make? 1, after I'm dead, will you come to visit me? 2, who will take care of me when I am dead? 3, will it hurt me when I die? Or 4, can you help me do a videotape about dying from leukemia? Now this is a school-age child, so the answer to this is number 3. Will it hurt me when I die? Because they're fearful of body mutilation. If you take a look back at answers number 1 and 2, notice that both of these are the same stage. It seems they seem to not understand that death is the end of life as we know it. So both of these are the preschool stage. But even if you couldn't identify it as preschool stage, if you recognize them as being the same stage, you could eliminate those two answers. And answer number 4 describes, of course, more the thinking of an adolescent as they're thinking about death.